All right, today we're putting on our detective hats. We've got a medical case with a set of symptoms that, at first glance, seem totally random, completely unrelated. Our mission? To connect the dots and solve this really fascinating medical mystery together.
So, here are the facts of the case. We have a 70-year-old woman. She's got this persistent ringing in her ears, that's tinnitus, and a kind of brain fog that's making it really hard to focus. But here's the kicker, the really weird clue. She's been compulsively eating ice. We're talking 6 cups in the last hour. So what in the world could possibly connect all 3 of those things? Let's find out.
You know, after looking at all the evidence, every single sign is pointing to one specific underlying condition. So, it's time to unmask our culprit.
And there you have it, chronic anemia. Hey, if you guessed that seriously, well done. But for the rest of us, the big question is, how? How do ringing ears, brain fog, and this bizarre craving for ice all lead directly to this one diagnosis?
Okay, before we break down all those clues, let's just get a quick handle on what anemia actually is. In simple terms, it just means your body doesn't have enough healthy red blood cells to carry the right amount of oxygen to all your tissues. Think about it like this. Your red blood cells are like a massive fleet of delivery trucks. Their only job is to pick up oxygen from your lungs and deliver it everywhere. With anemia, you just have way fewer trucks on the road. So what happens? Deliveries slow down, and some parts of your body start to really feel that shortage. Now, let's take that idea of an oxygen shortage and connect it right back to our patient. We're going to go through each of her symptoms one by one and see how they are all just classic signs of that delivery fleet not being able to keep up with demand.
First up, that tinnitus. So inside our inner ear, we have these incredibly delicate little hair cells that help us hear. Turns out, they are super sensitive. When they don't get the constant, steady supply of oxygen they need, they can get stressed out and start to misfire. And that creates a phantom ringing or buzzing sound. It's a direct result of that reduced oxygen delivery we were just talking about.
Include number 2, the trouble concentrating? Oh, this makes total sense. Your brain is a massive oxygen hog. It uses about 20% of all the oxygen your body takes in. So when that supply starts to dip, your cognitive functions, things like focus, memory, clear thinking, they're some of the very first things to take a hit. People often call it brain fog, and it is another direct consequence of anemia.
And now for our strangest clue of all. This intense craving for ice actually has a clinical name. It's called pagophagia. And get this, it's a classic, straight out of a textbook sign of iron-deficiency anemia, which is the most common type. Now, doctors aren't 100% sure why this happens, but a couple of theories are that it might soothe inflammation in the mouth that anemia can cause, or maybe the cold just gives a little jolt of alertness to fight off the fatigue. Either way, it's one of the most reliable clues you can get.
Of course, our patient's symptoms aren't the only ones out there. Anemia can show up in other ways too, like headaches, feeling dizzy, or having a really fast heartbeat as your heart tries to work overtime to pump what little oxygen is available around. You might also see really pale skin, that's called pallor, or even shortness of breath. It's a condition that can really show itself in a whole range of signs.
Now, an absolutely crucial part of any good diagnosis is ruling out what it isn't, right? By eliminating the other medical suspects, we can become way more confident in our conclusion.
And this, right here, is where the whole case just locks into place. Take a look. Notice how only chronic anemia checks all the boxes for our patient's very unique combination of symptoms. The other possibilities, they just don't fit the profile. Things like leukemia and lymphoma usually come with a whole different set of signs, like a fever or swollen lymph nodes. Polycythemia would probably cause flushed, reddish skin. Our patient doesn't have any of that. The evidence for anemia is just overwhelming.
Really, this entire case pretty much hinges on that one single powerful clue, that telltale craving for ice. It really is the key that unlocks this whole mystery.
This is such a fantastic piece of clinical wisdom. It's almost like a diagnostic shortcut or a cheat code. Some symptoms are just so strongly connected to one single condition that they act like a giant flashing neon sign. And pagophagia, this ice craving, is one of them. The moment you hear ice craving, your mind should immediately jump to iron-deficiency anemia.
So what's the big takeaway here? Well, our bodies have all these ways of telling us that something's wrong, and sometimes those signals are just weird. But a lot of the time, it's that one bizarre, unusual symptom that gives you the most direct path to what's really going on under the surface.
And that kind of leaves us with a final thought, doesn't it? This whole case was solved because someone paid attention to a very strange but very significant clue. It just makes you wonder, What other unusual signals might our bodies be sending us that we're just tempted to brush off or overlook? It's a great reminder to always listen closely to the evidence.